Hello, everyone, and welcome to the Strength and Hormones podcast. I'm your host, Lauren Papanos, and today I'm joined by Christa Biegler, and we're going to be talking about ADHD and its overlap with hormones and all the things that you may be questioning about what drives ADHD and where there might be some overlap with hormonal imbalances and such. So, super excited to have her. We have not talked about this topic on any episodes on the podcast, so I'm looking forward to diving into it. Thank you so much for being here, Krista, and welcome.
Yeah, thank you so much for having me.
Tell us a little bit about why you have interest in this subject, where that started.
Yeah. So these days, I usually talk a lot about
Mhm.
skin and food sensitivity issues, and each one of the things. But if I had my choice, I would be talking about fatigue and this topic specifically because, as a crazy results focused person, I am obsessed with relapse prevention. And I found that not only do some of the things that we're about to talk about have a lot to do with relapse prevention of other symptoms, but not surprisingly, I think this happens to us a lot in practice. My own individual health crises kind of led me down a certain path. So I always kind of make a joke that I've had most of the problems that my clients have had. And so one of my second health crises was that I was helping develop a fasting program in 2017, 2018, and I crashed all my stress hormones. And so it created these symptoms that really felt like magnified ADHD. And that's kind of the woman that my heart is after because there is you see this all the time. This is kind of the beauty of the gray zone that we work in. There are people that will always fall through the cracks because conventionally we are not set up for subclinical diagnoses, right? So, like the step before you are actually diagnosed. But myself, my clients, sometimes we walk around and say, we literally have had the thoughts, do I have a brain tumor? I cannot remember why I walked in here, right? Or you're feeling really scattered or just squirrel brain, I call it. Or you're like, I just feel puffy. I just feel puffy. And so this is for that woman who really questions, should I go get an ADHD diagnosis? Like, is that my problem? And something that was starting to frustrate me online, Lauren, was, and it's probably just the algorithm, but I had to stop following accounts that were marketing themselves to ADHD because as a person who does integrative nutrition and likes to question everything, I said to myself, "This really looks what if this is not really ADHD?" Right? Not to discredit any diagnosis, but diagnosis is the beginning. Very often it's a validation piece, but it's really a beginning point because what are we gonna do with a diagnosis after we have it? We can one stand an identity, but for me, I'm like, but then what? What are we gonna do with this? Is there something we can do about it? So there's a set of us that are like, I'm not content with this, right? And so what am I gonna do with that? So these symptoms just overlap, and it's just a area I wanna shine more light on because otherwise, how do people know about it?
Totally. I think that's such a good point you bring up. And yeah, I think that ADHD is a big conversation. And I know even a lot of like adults are kind of getting diagnosed with it nowadays. And, the question always in my mind is like, well, is this really ADHD or is it, some type of stress response or other type of hormonal response? So super excited to talk about the connection there. Tell us a little bit about like, just that subject as an introduction, like, do you really feel like most people that have been diagnosed with ADHD have ADHD, or do you feel like there's other symptoms that are brewing that kind of are manifesting as ADHD?
Okay, I'll do my best to answer this because I'm not a diagnosing clinician. So I'm going to be biased by what I see, right, in practice, which my entire mentality, approach to practice these days is a systems approach. Probably like you, probably like many. It's just a matter of how do we support people. So, something I have started to say is that most of what I'm doing is bringing systems or organ systems back into balance because when those are out of balance, you have symptoms. So, you know, in the literature, right, which is a little dated typically by the time things end up in literature, like we're looking at a fair amount of historical data, the percentage of actually diagnosed ADHD doesn't look as significant. I think it might be around 5% of the population. It doesn't look as significant as the internet is kind of like magnifying it overall. And so I think your question was, do you think that it is really as prevalent as it is, or is it other issues? Well, here's my concern with it. when we look at symptoms, so there's a lot of, and I'm again not going to pretend to be an expert on diagnosing ADHD or ADD, and there's obviously people who need medications around that. My thought process is questioning when you have these symptoms. So some of the symptoms of ADD or ADHD would be like forgetfulness, difficulty focusing, disorganized, challenge with time management, emotional mood swings. I'm sorry, is that all of us? That feels like all of us, and that's because I think we do have an epidemic of stress hormone issues, not shockingly. I think it's much more and it's easier for me to put put that big umbrella over the top of it before I zoom in, because once you zoom in, context is needed. So, when I think about stress hormones, and I like to talk about this from a I mean, your podcast is called Strength and Hormones, so you get this fully, but one of the things people used to say for years was, "Should I test my hormones?" I'm like, "Okay, which hormones are we talking about?" Right? So I like to separate those. I personally think the category of stress hormones, I think there's a hierarchy. I think that adrenals, nothing cares if the adrenals aren't supported. And I need to say that first because conventionally we don't really look at that or value it. I always say don't blame your provider. Their adrenals are fried too. Like it's literally they went to medical school. There's no we really only diagnose adrenal conditions when we're not functional anymore. Like our quality of life is gone. So, but I think it's a skill to learn to always support your adrenals. And why does that matter? Why is that at the bottom of the hierarchy, the foundation everything is built on? Is because of course your body has to make cortisol or it dies. And so your body's going to downregulate everything else to make it. Okay. So the next piece of the hierarchy, and I'm just kind of riffing a little bit because I feel if I start out saying, hey, did you realize that the symptoms I just listed for ADD like symptoms, and of course there's many more, are like pretty much the exact same if you have a slow thyroid, right? The issue with saying that or leading with that is people have a stereotype. They say, I've had my thyroid tested. I'm like, all right, just slow down, right? Because I think we can all not only support our adrenals, which is the bottom of the pyramid, when I think of hierarchy, if you wanna have good sex hormones, this is necessary, of course, I'm sure you talk about this all the time. But then next is it's always nice when other people come and back you up, right? So, next to me is really thyroid. And so the thyroid just doesn't care if the adrenals are challenged or there's so many other organ systems that impact thyroid. But what I will say is you can do, obviously a blood thyroid panel with the provider. They're not gonna do a full thyroid panel. And if you do a full thyroid panel and you still feel like you have symptoms, and there are many symptoms, of course, there are very clinical symptoms. The dead ringers are I'm losing hair, I am really fatigued, I'm feeling cold, hands and feet at least, maybe even really cold. But there's also those same ones we have for ADHD, which is trouble focusing, forgetfulness, feeling scattered. They are there, and when you have a sluggish thyroid hormone, you are also at an increased risk for depression and anxiety, so you're gonna have those emotional mood swings that I talked about earlier as well. And so this reminds me, I'm gonna take a little bit of a tangent here. It reminds me of, do you remember at the beginning of the pandemic, we'll say that, right? That we were talking about the symptoms of the virus were super overlapping with the symptoms of zinc deficiency. Remember that? It was like loss of tongue, whatever. And so that's just kind of how we think. And so sometimes once you see this overlap, I just had to start unfollowing certain accounts that were talking ADHD because I was like, oh my gosh, don't feel like you're stuck. Like there's things you can do. But anyway, back to the hormone hierarchy. So we got our adrenals, we got our thyroid, and before anything is ever off in your blood labs, you will have symptoms. And if I can just I will just die on this hill for the rest of my career, address your symptoms before your test results, you will get faster results anytime possible, right? So I just think there's a real skill in learning how these symptoms correlate with this organ system and then what can I do to love on and support that organ system? So I'll say that first. I'll say all that first. But I feel like I have to be so careful before I even the word thyroid pops out of my mouth because people have this real knee jerk reaction of, oh, I tested my thyroid. I'm like, okay, here goes another 5-minute monologue on, why does this matter? And, is there some testing that will show us subclinical thyroid? Yes, that is an option as well, but also symptoms, right? So that's my big like plea is what if we really just need to support a system and we can improve those symptoms, right? What if we're not stuck with those symptoms? And I'm like a product of that. Many of my clients are products of that. And I came about this because I had to, right? I didn't come about this because like, oh, I need to learn more stuff, that's how it feels, right? Never know enough. But, the other piece of this with subclinical thyroid symptoms, because I work with a lot of skin stuff, is dry skin, right? What happens when the thyroid slows down well before it goes up on labs is you have sluggish motility, meaning you're not pooping very well. And my metaphor for that is that it's kind of like a bird bath that's not running. When you have a bird bath that's not running, like stuff grows, it's stagnant, right? And so then you have relapse of gut issues. And also, when the thyroid is underperforming, your body temp is just slightly like a fraction lower, which allows fungus to overgrow. So you can have these like fungal symptoms recur. And I just see it over and over and over. It's so interesting to work with humans and be like, are we talking about your case or my case? Because they feel so identical. So it's a gift and maybe a curse sometimes, but it's also, I love the nuance in between. I love being able to support the thing that is falling through the cracks everywhere else. And that's what I feel like this topic is. So
Yeah, and I don't think a lot of people realize too that thyroid testing wasn't actually even utilized until like the 1970s because of its inaccuracy. And so there is a lot of inaccuracy within testing. And I don't even honestly think we can rely 100% even on the hormone values
Mm-mm.
because, we know cellular hypothyroidism occurs where you could have plenty of thyroid hormones there, but they're not actually getting into the cells and tissues that need
Mm.
them. And that's where people feel stuck and they're still symptomatic. And this is something we so often see with a lot of these cognitive symptoms and the brain inflammation, the depression, all those variables. So I think it's a really good point that you bring up. And yeah, I love the thyroid because I think it really is center to everything. Of course the adrenals are beneath that, but that the thyroid is influencing the menstrual cycle and your mood and your motility, and so many factors have to be addressed there first before we can really see resolution in other areas.
It's a huge
uh,
topic. It's a
yeah,
huge
yeah.
topic. It's not like "Oh, we'll summarize it here." Like, "Oh, we're actually just gonna open the conversation to help you think like, oh, this actually really resonates for me," right? And even I tell my clients, I'm like, "This will take experimentation," right? There isn't like 1 or 2 little steps. There's a lot of steps to support this system to feel the way you wanna feel.
Clean.
But
Yeah,
the good news is you got options. It's a good thing, right? Like, you're not stuck.
totally. Yeah. So let's talk about what those current options look like in the conventional system for ADHD. What are the current treatment methods of if someone goes into their provider and thinks that they have attention deficit disorder or ADHD, what they're typically prescribed or recommended to do?
Perfect. Yeah, and I can't talk a ton about the diagnostics, but I can talk about the treatment. So
Yeah.
there's 2 main medications that are prescribed, and they do have a lot of utility for those that need them. I mean, they do seem to work. A lot of people talk about this, and that's what we love with medication, right? Do things work? So they're generally stimulant drugs, and they are Adderall and Vyvanse. So they're kind of stimulating prefrontal cortex to sort of help with executive function, et cetera. And that's I mean, really it for me. It's like they're a stimulant, um, and they do work. I don't even know all of the negative side effects of them, to be perfectly honest, but those are the main drug categories that are prescribed when someone has ADHD. And of course, just like your clients, mine come and they might be okay with that, like they might want to function, but a lot of people sometimes people want to pursue is there any non-medication options?
Yeah. Yeah, and I don't know how many, like, adrenal panels you've looked at individuals that have been on any of those long term, but I know I've seen my share, and, their adrenals are pretty shot.
Well, doesn't
Uh,
it makes perfect sense. Like that would
yeah,
make I mean, that probably was happening before they
totally.
were run on the medication, right?
Yeah,
I think about I don't know, and that's I work with a bunch of people on steroids, and of course that's going to turn off even cortisol production. So that's going to be really similar. It's just like what came first, the chicken or the egg, right?
yeah, absolutely. Okay, so those are the common medications. We won't get too much into their, side effects and the ramifications of them. So let's kind of talk about like what are some of those other approaches that you are utilizing with a lot of your clients. Maybe we can start with just honing in more on like the nutrition side of things first and foremost, and then we can get into some of the other lifestyle supportive practices.
Perfect. I mean, this conversation could go anywhere, and I think it really boils down to, so I think about it from a couple perspectives. I like to zoom out before I zoom in, just because then it feels more informed instead of like a whack-a-mole if we know kind of what approach we're taking. So when I zoom all the way out, and you asked me to talk about nutrition, but I have to mention the health triad first. For me, when I think about any kind of symptom or diagnoses, I wanna look through it with, like, a triangle lens of, on one angle, there's gonna be nutritional chemical, that's where I'm gonna spend most of my time. There's always kind of an emotional, energetic, stress component as well, and then there's usually, like, a structural and environmental. And so, with the like, on every symptom, every diagnosis, you can go about it from that, and it sometimes helps people put things into buckets, so that way they're not, because a common scenario is sometimes at some point in your journey, people feel like they're doing everything, right? And so it's nice to put things in buckets. So for example, with structural or environmental, it might look like endocrine disruptors, which could also end up under nutrition, right? So if I think about like the top to the bottom, because I could talk a lot, like the top to the bottom, when we think about how we're going to consider this, are we talking about managing symptoms of ADHD and like focus? Or are we talking about thyroid? And either one is fine. But at the very top, if we're putting it through the lens of ADHD and we're kind of considering things, and we're talking about nutrition specifically, just in the top, there is a lot of opportunities. There's some studies about like dyes, processed foods, literally reducing those. There was one study that showed like 40 to 50% of clients, way more than that, because it was only 1% of the study that said that there was no change, right, in pediatrics. So there is that component, which is okay for all of us, right? Like it's okay for anyone to trial that kind of thing. As far as nutrition, before I when I'm I when I'm thinking of nutrition, it's like something that comes up is diet and then micronutrients and all of those pieces. So also a very common thing is gluten-free, simply because, and I'm, just to be clear, like I'm a huge fan of food freedom and like eat whatever you can, that's like to enjoy your life, enjoy your birthday, enjoy your cake. But there is a clear association between actual celiac disease and ADHD. And so for some people, their only symptom of celiac disease is obscene brain fog. So that is a possibility to just rule out. So I'll mention those things. Those are usually really top level things. And then again, as we go down the nutrition rabbit hole, there's a lot of opportunity. There's a lot of like surface level opportunities, literally just for ADHD, including omega 3s for brain health, phosphatidylserine, specific herbs, I think rosemary, etc., for brain focus. And then how I tend to think of it, if I'm looking at someone, let's pretend I'm setting aside the concept of thyroid, because there's a whole set of things there, which we can talk about if you want. But if I'm just thinking about brain fog, trouble focusing, etc., which by the way, I need to utilize these things personally throughout the month, because as we all know, if you're listening to Lauren's podcast, our hormones are not consistent throughout the month, right? As a menstruating woman. And so that was this week for me. I was like, sweet, love going on podcasts when it's my period, because I definitely feel like performing. I'm joking. But that's when your energy is the lowest and sometimes your focus is the lowest. And why could that be? We can talk about that. So many reasons, right? And it can be, there's multiple things that can prove it. But I just think the concept of nootropics is just, it's a fine thing you can utilize whenever. Like if I got to sit down and do my taxes and I don't feel like it, if I got to sit down and finish a presentation, I don't feel like it, nootropics are there to help me, right? And so nootropics is just a fancy name for brain nutrients that support the brain. And there are so many of them. Some of them I've already mentioned, including phosphorine. Some other really common, well-known ones would be lion's mane mushroom, right? Ginkgo biloba, mag-threonate. Mag-threonate
Ooh.
is a type of mag that crosses the blood-brain barrier that helps with mental focus and clarity. And so there's a lot of products on the market. I still love to test different products. Some of them are a bit pricey, but I personally look at supplements at this point, like once I'm not in a healing phase, right? Which if you're in a healing phase, you're doing more intensive stuff for a few months to get a certain result. But for me, who's in more maintenance, I'm looking to use supplements as shortcuts to get results that I want. So if I want to focus that day, but it was the day before my period and I don't feel, let's say I need to show up for a conversation with you, I'm gonna I'm gonna give myself something to show up if I want to. I don't have to. The rest of society just relies on taking shots of espresso. Whatever is your jam, right? That may not be the most the best thing for the adrenals forever. So I like to tap into different things like nootropics to give me. It's just one of those like top level things that you could certainly do, and it's a really easy possibility, even for someone who might be on a medication and is questioning, do I need this? How would I perform off of it? I think nootropics are a really nice thing that they could potentially trial just at a very top level. The question is always, how much do you want to do? How much do you want to try? Right? Like, how much effort do you want to put in? Do you want to be all in right away, or do you want to just trial a couple things? And either approach is fine, right? It just depends on your level of motivation, or might I say desperation.
Yeah. Well, and I know it's not technically considered a nootropic, but I even think, like, with all the craze around creatine right now, like creatine monohydrate, we know that once it's like fully saturated muscle stores, that's where you can see some of the benefits for like cognition. So that's I know there's some research that I've looked at recently where it showed that closer to like 20 grams per day is where you can actually see some of the cognitive benefits, especially in like a period of sleep deprivation. So I've been personally kind of playing around with that as I have a 6-month-old baby right now and I'm still a bit sleep deprived. Um, so, I think that there's even like things that aren't necessarily like nootropics to your point, but still are like giving us some of this like cognition benefit that could
Yeah.
really benefit this type of population.
Right. Well, and on that note, anything with correcting gut microbiome because of the gut brain
Yeah,
connection. I mean,
sure.
if we're talking about brain fog, it's almost hard which bucket to put it in on which organ system because it actually can be related to sluggish detox, which by the way is a topic you must talk about with thyroid because of the last step of thyroid conversion happens in the liver. So I always feel like all trails go back to the liver. There's not like some quick test you run to the doctor and do and it shows you everything. No, usually everything's a disaster if anything shows up on those blood tests. That's
Yeah.
kind of my
People are
rule
like,
of thumb on that one. What?
and when people are like, my ALT and AST looks fine.
Like,
I'm like, that's
yeah, that's
here.
doesn't really matter. I mean, maybe if you have an infection, it'll go off, right? But I would say if the brain fog, so it's like, let's add context to the brain fog. And I always have to be careful, I'm sure you do too. I have to talk about a symptom with different words because there are many high achieving performers that are not going to resonate with the word brain fog, but they might resonate with like feeling scattered or squirrel brain or feeling like they're pulled in a lot of directions. And I think it's pretty similar. I think it's about the same thing. So I call it all the things. I do the same thing with indigestion because people don't always resonate with that word either, right? So
Mhm.
anyway, but if brain fog or cloudiness or trouble focusing is happening after eating, I think that you do want to go look at the gut microbiome because just basic physiology, just track it, right? The food goes in, it's not getting digested, and the undigested stuff is feeding the weeds in your gut, and then it gives off these toxins. Then those toxins are kind of crossing blood-brain barrier, and now you're kind of foggy, essentially.
Mm.
So that's kind of what that means to me if it's after meals or just poor digestion in general. There's a few other varieties of that, but anything with gut imbalance, of course, is going to make a difference. So that's just always a place we can all do like a simple or a more aggressive approach to clearing that. And similarly, as I already mentioned, like the liver is already always involved there. The nice thing about the things that we do that are really food based or nutrient based is that one nutrient doesn't do one thing like you just said with creatine, it does lots of things. So that's always my favorite if you're taking one thing and it's like, by the way, it supports this, 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 and this. So that's kind of nice. Like you're getting five benefits from trying one thing. So I did
Totally.
forget a nutrient or a nutraceutical. I was talking about, like, rosemary and foscarine and omegas. I would say, like, I'm not sure how I love omegas for lots of reasons, but I don't know if, like I haven't really seen a lot where you take omegas and your brain is automatically better. That said, like, because I usually look at it from a different perspective, so I'll say that. But saffron, which is a very expensive spice, is also considered in this pile of stuff that might be supportive around cognition as well as just generally like polyphenols.
Yeah, I know there's some more emerging research that's come out recently about saffron. What are your thoughts on like, and I don't know if you dove into this at all, but methylene blue with this type of population?
So I've done, interviews on methylene blue, and I get asked that question. I haven't really had a chance to experiment heavily. I did buy it. I have tried it. The guy I interviewed, I mean, there's a lot of the cool thing in life is I like to think about it with rose-colored glasses, all the things. I'm like, the cool thing is there's a lot of options, right? For me personally, I got such a headache from methylene blue that the human reaction is like, I'm not going to take that again right now. Even though I have 4 boxes in the closet, I haven't gotten around to trying it again. I think anything is worth a shot if someone wants to try it, right? But I haven't done enough experimentation. Anything I have there is anecdotal, so no comments. Some people have said, yes, they like it. Some people have said no. Definitely, it's one of those things. It's kind of an interesting topic because it's synthetic, and so you definitely wanna source it like, it was originally used to clean fish tanks, and so, I that's a neutral statement from me, but you always like with anything, you always wanna source it well, of course.
Of course. Yeah. Yeah, of course. Especially with that one.
Yeah.
I don't wanna be eating fish tank cleaner. Okay, so you mentioned that with a lot of your clients, you see that can maybe come in that have a neurodivergent diagnosis. Maybe they have symptoms of ADHD, that there's this thyroid piece that's underlying it. What do you typically see with these individuals? Is it like, okay, once we've corrected the root causes of what are driving the thyroid dysfunction, they notice like their brain fog starts to clear? Are they able to come off of medication? Kind of walk us through like what that process looks like.
So I could talk about this from a lot of angles. A lot of times so I started this conversation by saying systems-based approach. How do we support as many of these systems that are not getting love and support as fast and as easily as possible so it's not a bunch of random stuff that you're on so you're not just like taking a bunch of crap. So, I will usually if there is reason to support gut stuff, I'm usually going to do that while supporting drainage and clearance because I had just mentioned before that everything all roads tend to lead back to drainage and especially with the liver, I feel like this is an underrated part of supporting the thyroid because T4 to T3 conversion happens there. Also, the underrated thing with all hormones is the brain and like what's happening in brain and stress. So I'm always integrating nervous system stuff throughout. Like I do live nervous system stuff. So I'm integrating that. And then we get into and where this all started for me, Lauren, was 5 plus years ago. I started running hair tissue mineral analysis, which was very helpful because the most common scenario I saw for those 5 years was women that had depleted adrenal or adrenal insufficiency and sluggish thyroid. And it was very validating because the symptoms were there, but it was nice to have a test that would show it because even the old ways that I used to look at adrenal function, there were issues with it. If there was any abdominal like, if I was using the 4-part um, adrenal test from, like, Dutch or something, if you
Yeah.
have abdominal adiposity, it was gonna screw with the metabolized cortisol, so it's gonna make it look a little off. It was just, like, frustrating because I think the most invalidating thing is when someone feels a certain way, right? And the tests are like, "Well, the tests are fine," right? So I think that there is I've at this point in practice, right? I've been practicing a long time. I'm like, I don't really need the test to tell me what your symptoms are telling me. However, if you need it, fantastic, right? So I can go both sides. I take a really informed consent approach at this point in time, meaning I really want to educate you before you spend a bunch of money and then you're like, oh, this actually didn't tell me anything. I'm like, that's always actually how it is. You have to be okay with the test not telling you anything, and go in with that feeling. Okay, so I started doing that like over 5 years ago, and that was the profile I was seeing. And so what we were doing was really supporting. I think about adrenals from like a a three-pronged stool, right? Minerals, mitochondrial support, specific adrenal support. That is a good start because you're going to actually one of the symptoms of sluggish thyroid is going to be low energy, but actually low energy can come from pretty much lots of things. Lots and lots of things. If I had my way, I'd just support energy. I'd support women with babies that think that they just have a baby and they don't have enough energy, right? Like, of course. And so then after that, what are we doing for thyroid specific? So I kind of have a little bit of maybe like a 4 steps really quick that might be helpful. So first, I would assess for thyroid symptoms. So I'm just gonna spit out a handful if you don't mind. And I would say like generally I'm looking at the sluggish thyroid symptoms to the hypothyroid symptoms. So it's tiger sluggish, feeling cold in either your hands, feet, or your whole body, puffy. So these are I'm gonna highlight some really really sneaky ones. Feeling like you have a full face, or even kind of just feeling puffy, like your weight isn't different, but you're just feeling a little bit puffy. I think that's also your thyroid. I can say that with a lot of confidence because I've experienced it all. And then clients have said it. I'm like, oh, I know exactly what you mean. Um, difficult, or like motility is slow. You're not pooping every day. Or this is a big one. You feel like you need coffee to poop. I personally think all of those are sluggish thyroid. Some other really subclinical ones would be like dry skin, scalp, dry feet. We talked about this one already, slow brain processing, brain fog, squirrel brain. Whole bunch of other ones might include fertility issues, um, sex drive issues, of course. And then the other big one is like any kind of thinning of hair or like thinning of the eyebrows. I think those are like more severe personally, or depression and anxiety. The other one that gets a lot of bad rap is gaining weight easily, but I would say like there's so many reasons for that, of course, as well. So the reason I bring all of that up is because I think the first step is assessing for symptoms. And I think if you're like, yes, 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 to at least a few symptoms, then I think it's worthwhile to love. I always like to think about it like this, to love on the thyroid. And again, just to reiterate why you should give a rat's poop about this is because the sluggish thyroid with that slow motility can create gut relapse and that fungal overgrowth and dry skin and brain fog. And all of those are things people just resolved and don't want again, right? And that kind of stuff can ebb and flow. So the more you know, the better off you are to not have these issues in the future. So that's why I think assessment is always like your own self awareness is always the first step for absolutely everything. Okay. Which is really the gold of this show today, right? Like it's like I hope if anything, if this was for you, it was really helpful to be like, "Oh my gosh, I have options." Okay. The next ones are probably I want to mention like the big stuff before the little stuff, which everyone's going to be excited about the little stuff and less about the big stuff. But I always personally kind of need to be reminded of this as well. I feel like I've already adjusted my life around this, but anywhere I can remove like toxic burden stress from the outside and endocrine disruptors. So, what is my skin touching and what am I breathing in all day, right? So any kind of plastics or personal care products with crap. And then also for me, halogens were a really big deal. Chlorine was actually like multiple days of chlorine exposure was kind of a catalyst for one of my first health crises where I broke out in a rash. And I later realized, like, oh, I got major halogen issues. So I'll get to that in a moment. But halogens are iodine, chlorine, and bromine. And bromine, as you may know, we used to use iodine as a dough conditioner, like I don't know if it was till the 80s. And then they said, "Oh, that's too much iodine in bread." So they replaced it with bromine. But the thing is that these halogens all sit on the same receptor seats. And so the chlorine that's in the water, not only does it have some other things, but these like take up receptor sites that iodine would really sit in. And iodine is a bit of a black sheep in conventional and functional. I am very pro iodine because it had changed my life. I'll get to it in a second. But I went off on a tangent there. Just remove endocrine disruptors and the amount of crap coming in. I understand that that's not always easy. It's like do your best and leave the rest, right? Am I traumatized by chlorine because of my personal experience of dealing with a rash for a long time around this? 100%, right? We're all going to live out of our own experiences, okay? So then from there, supporting, I know the things you don't care about, like that's the audience like, I've heard this. Support
Should care
stress.
about.
Right. I know. Support stress. And I think of it like a funnel, right? And it's like if you didn't address the top of the funnel, then the bottom is not gonna work as well without addressing the top, right? So I always think it's like good. I think for me, even just to be reminded of the severity of the endocrine disrupting chemicals and just kind of look at my life and like, is there anything that's kind of slipped away? So I'm just going to give another really tangible example around this because sometimes, like, the way I'm living is just like I'll be talking to a friend and we're like, oh, I didn't think about that. In the summertime, I am a fan of like getting prepared meals from Misfits Market or this like fish place or whatever. And a lot of my stuff has gone to being in paper packaging. But if it's ever in plastic packaging, I take it out and put it in glass or put it on a plate, right? And I know that's just such a simple little thing, but in my office here in town, like there's just a glass dish over there, right? So I'm just like never trying to heat plastic as much as possible. I'm always taking my lid off my coffee cups whenever possible because I just don't want to drink microplastics if I can avoid it. I mean, that's what'll happen when you sit through a lecture on microplastics. You're like, "Ew, I gotta get rid of that as much of that as possible," right? Because babies are born with microplastics, they're everywhere, right? It is kind of important, like, I just feel like so much goes back to drainage and liver, and we will it's a just I personally think that supporting the adrenals and drainage are just 2 skills that support people for their entire lives. Like, I'm gonna, again, die on that hill as well. Okay, so down the funnel, supporting the stress and the adrenal hormones. I talked about that a little bit earlier. I've kind of let it dance through the entire conversation because the thyroid doesn't really care if that's not supported, right? So, as you said, all those people you saw on those stimulants, and it makes sense, right? Because that's going to kind of ramp up their adrenal production until they burn out. So many pieces to that. I just think, again, the adrenals cannot be overstated too much on just loving those. So, love on them. When I think about them, I think about damaged cells. That's how I like to think about it. Like, the cells have been damaged. They're not always like, and I think about it kind of like a gas, a speedometer. It's like we press on them for so long, push, 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 and speed. We use up a lot of energy, and then eventually we're in a reserve tank and we're kind of barely going a little bit. So, support stress and adrenal hormones, that's the whole thing. And then from there, you can get fancy with nutrients for thyroid because there are a lot of nutrients that the thyroid likes that support conversion of the thyroid hormone. There are many. Some of my favorites are definitely iodine. I am a big fan of iodine in general, but that is not I will say that's a little bit of a tricky topic. It does need to be onboarded properly. And if you don't have the other cofactors, it may or may not go well. And by the way, it also happens to be there's a couple caveats. It happens to be antifungal, so it can cause die-off symptoms. And one of the other big caveats is that if you're going to go do blood testing, don't just remove it because it's going to make TSH look erratic without symptoms. It's going to make it look erratic because it's moving the iodine around and like all these cells need iodine. So it's going to be like kind of an Uber driver for it. Some other nutrients that the thyroid wants, there are so many. Potassium is, to me, I think really, really, really huge. I think really underrated. Probably one of my favorite nutrients that's underrated. Some other ones that are very commonly talked about for conversion are zinc and selenium. I personally try to get as much of that from food as possible or kind of look at mineral levels before over supplementing with those. Because once you kind of over supplement with zinc, you can create some other issues with copper. So that's my personal preference. Lots of B vitamins, vitamin C. So, like, the whole spectrum, really. And that's why I personally think like thyroid takes some time to optimize and why I like to go from like the top to the bottom personally. I would also say the reason I'm passionate, I'm glad I'm able to talk about this here today is because if you can figure out that you have symptoms before a diagnosis, before it shows up on blood labs, all of this stuff works a lot faster. So, literally, just like Lauren said, the people who she saw on the meds for a long time, there's a lot more, I would say, damage, right? Once we hit a diagnosis, there's more cellular change for longer, there's more depletion for longer. So, anytime you've had something going on longer or it's more significant, it can take a little bit more of a significant intervention to really see a difference. So if first you don't succeed, don't be discouraged. Like, there's a lot of opportunity. You may just need to do some modification and prioritization as well. So
Yeah, there's so many options out there. And, sometimes I think people think that there's only like a couple of avenues that we can take or a
no.
couple of testing, a couple of supplements, but there's so many opportunities. And I think that's what's so beautiful about functional medicine is that we have so many different systems of the body that we can look at that may need additional support. And, not everyone responds the same way to everything. And so, like you mentioned, going through kind of those different steps of like, okay, is this person that's struggling with ADHD, like, are they also struggling with adrenal and nervous system related issues? Or like, are they also struggling with thyroid issues? And like, maybe you're not struggling with adrenal issues, which that would be very rare because who isn't? But maybe you're not. And so then it's like, okay, maybe we can move on to the next layer, right? Which is like the thyroid. And maybe that's where you need some support. So I think that's so important, as you mentioned, to have that kind of like funnel view where we're looking at, okay, where's the foundation, and then what's the next step in this line of treatment.
Yeah, for sure. I agree.
Amazing. Okay, what's that?
I agree fully and completely.
Totally. And what do you typically see with individuals that have ADHD that have utilized some of these more natural approaches? Like they've gone through some of the root cause treatments or they utilize some of like the nootropics and things you talked about. are they reporting like, "Yes, my focus is better. I
Yeah, we're
feel
always
like"
looking at that for
yeah,
sure.
like, what are the tangible outcomes, the ROI that you're seeing?
Yeah, so the reason I mentioned starting with assessment is because kind of even the way I look at some of those interventions around thyroid. So you talked about earlier just how our testing kind of sucks, right? So like how are you going to measure results? And so symptom changes are how you measure results. So I like people to I have, like, lists that I have them do, right, of their generally, like, sluggish thyroid symptoms, and that's mostly what we've talked about today is sluggish thyroid, not fast thyroid. I will say that some people that do have lab testing for hyperthyroid symptoms, sometimes they'll go on medication and then end up with slow thyroid symptoms. So, just a side note, so you can end up in both. But anyway, so I have them assess their symptoms, and then we implement some of those interventions. Like it depends on the intervention, right? Of course. But if I'm doing something like nootropics or iodine or something like very specific, one of the ways we measure the efficacy is again being able to not do too many things at once so you can see what the difference and also not waiting too long. It's like usually I can see a difference in a pretty short term with some of those, but the main one is gonna be just literally, focus. You know, what's gonna be last is hair loss and cold hands and feet because those are the more severe ones, honestly. So, usually,
Yeah.
I'm personally looking for a pretty quick change in, like, mental acuity, focus, and, like, brain processing. Personally, I just like, that's the big win to me, with some of those, and I also think, like, unlike nootropics are sort of like a PRN, right? They're as needed. You throw them in sometimes, whereas supporting the actual nutrients that your thyroid needs to function on a daily basis, uh, that's that's time, money, that's just, like, well invested support. Like, any support you do to, like, actually help that organ system function is actually better investment because it's making that system, that factory work better, whereas a nootropic those nutrients, yeah, might do a lot of things, but you're kind of like you're putting them in there like symptom management instead of symptom resolution. So it's a little different angle or way to think about it, which I think is probably important to mention.
Yeah, I love that you bring that up because there are always things that are utilized like for treatment, and then there's things that we utilize for like performance, right? On an as need basis. And then there's even, I think, things that are like general health baseline, like you mentioned the omega 3s. And yes, omega 3s are great for the brain, but like they're also an essential fatty acid that like most people aren't eating enough of and like may need on an everyday basis just to like make sure that they're not deficient. So there's so many different roles that like each of these different nutraceuticals that nootropics like probably aren't something that's going to change the gut microbiome
No.
or make T4 convert over to T3 better, right? They're just like helping you operate
Right.
and perform better in that given task.
And one thing I'll say that comes to mind for me, like when you bring up the omega-3 thing and why I don't think of it like an automatic ADHD thing is because it's technically supporting all cell membranes, which supports everything. And so your body may have other priorities than what you have. Like it actually may be really struggling in way more areas. And so I think one of the things that happens is people put that in and they don't even put in very much because it's kind of expensive to take a good amount and a good dose.
Yeah.
Just my personal thoughts on this. And so your body's gonna need to do with it what it needs to do, right? And so there's gonna be certain, if you're ever kind of trying to figure this out, like ask your clinician, like what are the normal time frames and turnaround times? I mean, that's something I really value assessing and taking inventory and sharing and trying to communicate with people because people need to understand like what's a normal response, what's a non-normal response, what can I maybe see? And so I'm just saying it's like I don't know that you will see a difference. That said, I literally have an omega at home because I'm always trialing ones that are like gummies and whatnot for kids. And so I have one at home that's literally they label it for ADHD, which I think is I mean
Yeah.
I think the whole supplement brand is like ADHD type nutrients, which is cool. I mean,
Mhm.
I'm glad companies like that exist, honestly, because it makes someone out there trying to DIY and piecemeal it maybe a little bit easier for them. So kudos to them.
Totally. Yeah. Yeah. And I think everyone can benefit from some more omega 3s.
Yeah, I think so. Just because it's like, it actually just helps every cell function. So sorry if it didn't fix your ADHD symptoms the first day. It's not going to. It's fat soluble anyway. It's going to take some time for that to all
Yeah.
get in there, but it's probably busy doing other things that need to do because it's repairing from all the inflammation that you have going on that we all have inflammation to some extent. Like it's inevitable. Like because exercise causes inflammation. So, it's
Yeah.
just part of life.
Absolutely. Well, this is so wonderful. Thank you so much for sharing all this with us. And I love that this conversation ended up, us kind of talking about like our approach, I feel like within like functional medicine and nutrition, because it is so different, I think, than the conventional approach, which would probably just be band-aid the symptoms, right? And start you on a stimulant to be able to help your brain focus further. But I hope that listeners are able to really see the value and taking more of a body systems approach and utilizing safer options and how those can help with the bigger picture, like you just mentioned with the omega-3 fatty acids. So, really appreciate your work and your approach to things. And I would love if you could just share for our listeners where they can learn more about you and your awesome podcast and all of the resources that you're putting out.
Yeah. So first of all, I wanted to say thanks for letting me talk about this topic. I really love talking about it, and I hope that it was helpful because not only do people now have the option to choose between conventional and functional, they also have quite a lot of flavors of functional and integrative, right? And there's kind of, I can maybe leave it at that. Like there's a lot of different rationales and approaches. And that's not necessarily bad, but it just means sometimes you have to find someone that resonates with you. And fortunately or unfortunately, sometimes that comes with going somewhere that was not the perfect fit for you. And then you can appreciate maybe a slightly different model because of not getting results from that. So I just mentioned that because it's just something I see a lot of. I'm sure you see a lot of it as well. So you can find me on my own podcast, which is called The Less Stressed Life, which has been around since 2017, which is kind of crazy. If I had my way, I would just interview people all day and learn things. That would be fun. So please, if you are listening to this and you would like any more of this, please come check me out at Less Stress Life. Otherwise, you can pretty much find me at christabiegler.com, and on Instagram, I'm anti-inflammatory nutritionist.
Wonderful. And we'll include all that in the show notes and all of your resources and everything. So thank you so much, Krista. I really appreciate the conversation.
Thank you for having me.